to the podcast and speaking to us today. I appreciate it. And I know everybody else will appreciate your story and what you have to offer.
Thank you so much, Monique, for having me.
Oh, it's my pleasure, dear. It's my pleasure. So how did you meet hubby? When did that all start?
We met in undergrad, in chemistry class, actually.
Oh, okay. So was it an instant connection, or was it took some time and some relationship building?
Yeah, it took some time. We were more friends for a while, and we just were in like the same study groups. And he was actually dating the TA of our lab.
What?
Yeah.
Interesting. The plot thickens. Oh. I love it.
And yeah, so he, I don't know what happened with them. I'm not from the town that we went to school in, so I left for the summer to study in Memphis, Tennessee, actually. And I love Memphis. It's a beautiful town. And I came back and they weren't together anymore, and we just started hanging out again. And yeah, that was in 2002. I'm old.
Girl, no, we're just getting better with age. We're getting better with age, okay? I refuse to call myself old or anybody. I don't even like calling my mom old. Like, it feels funny to me because it's like we get better with time. So I feel like we're just aging gracefully, you know? But thank you for sharing that with us. And so how long were you guys married before you started trying to conceive? And was it something that you knew would come easy, did you have a diagnosis prior to that, like PCOS or anything?
I didn't know. And we drug our feet on marriage. We went to Alaska together after pharmacy school, and we lived in a remote village there. We were both pharmacists and went to pharmacy school together. We've been together all these years, and we just kind of were so busy we didn't think about getting married. And in 2000, and we were engaged in 2010 when we moved to Alaska. And then in 2012, we accidentally got pregnant. And so we were like, oh, this is great. Okay, well, we can do this. We were wanting to it had been 2 years since we were engaged. We were trying to figure out when we could get married, when it would all work out, and going back and forth. He doesn't like spending money or parties, so or the center of attention. So he didn't really want a wedding, and I wasn't sure what I wanted. So we ended up going to Las Vegas. But we had the pregnancy, the first one, and I had some spotting early on, and I ended up having to see a doctor that I worked with because it was such a small town, and it was just a native only hospital, but they let non-native friends come too because of, not access to healthcare. And so he did an ultrasound there, and I remember he didn't even look at me. He just looked at my husband and said, well, I hope you didn't tell your family. And it was just really heartbreaking, like the bedside manner, especially someone that I worked with and I would see every day. So that was really rough. And we had a trip planned that week. It was Labor Day.
Wow.
And we were going to go home, see our family, and we decided not to. So I was scared, and I didn't know, even as a healthcare professional, I didn't know a lot about miscarriages at the time. And I had been on birth control for so long that I didn't really think about it. And the doctor kind of pressured me into a D&C, like, just get it over with, he kind of said. And I'm sad that I did that, because now looking back, I'm kind of wondering if I was never actually diagnosed with Asherman Syndrome, but they kind of think that's what happened with maybe some of the ectopics that I had. On my last failed IVF transfer, right before they were going to do the transfer, they were going to cancel it and then do, the testing of my uterus to kind of see if I had any scarring. But at the last minute, they said, well, let's try. And I ended up having my daughter. So that was exciting.
Yeah. So what was the time frame like between the first loss and then having your daughter? Was it like a year, 2 years time frame?
It was quite a bit of time. So 2012, I had my first miscarriage. I went on to have 5 miscarriages, 1 tubal ectopic, and then I had 1 cervical ectopic, which I kind of told you about earlier. That's a pregnancy that stuck in my cervix, and that was in 2013.
Gotcha.
And it was like towards the end. And it took me probably, I would say, 6 months to recover from that, because I had to take methotrexate for 10 days. And then it took months for my HCG to get down to 0. Lots of blood tests, lots of sadness. And then after that, the doctor, she was an amazing doctor. She said, with your history of implantation in the wrong spot, it'd probably best if you just went on to IVF. because we know you can get pregnant. I needed help. At that point, I was using Femara.
Okay.
And she said, but it's not going to the right spot and it's dangerous for you.
Yeah, for sure.
So.
Wow. We got married in Vegas too. I just wanted to bring the vibe back up just a little bit. We got married in Vegas too. We got married at the Paris Hotel.
I love that. We did the little white chapel where Britney Spears got married.
Yes, that is so cute. I love it. Yes, we did. So we have something else in common that's more joyful, right? Other than fertility struggles. It's so crazy that we have to meet on these terms. But I am grateful for you to come on here because you are the first pharmacologist that I've had on the show who has her specialty in like the fertility field and things. So can you tell us what the Asherman Syndrome is for those who may not know or be real familiar with it?
So Asherman Syndrome is more scarring in your uterus, and it can be from, some people can get it from, undiagnosed STDs possibly where they've had infection in their uterus. Gotcha. It can also be from, past like surgical procedures. So D&Cs, abortions, things like that. For me, it may be what caused, because I did have that D&C. Yeah. And so it could be what happened. I do know that it's hard. It's really hard. And I think all the losses just kind of added up and I got defeated. And I was at this low point where I thought, well, either I pick myself up, I move forward and figure this, like get to work is what I always tell people, or I just let it overtake me and give up.
Have you always been an independent self-soother type of person, or did you seek therapy?
My husband made me. He really.
That's good for him.
He didn't really. Yeah, it's not like he made me, but he really advocated that for me. So he stood up, and he was like, we need to do this. You need to do this. You need to talk to someone. And so, I appreciate you asking that because that was a huge piece and something that it was hard for me to, because like I said, I lived in a remote place. There wasn't a lot of access to care, but I found it. And access to care that was private. Does that make sense?
Yes,
when you work at a place that you have to see all the providers, it's not always private. Or
I can imagine it being very awkward, whether they know or not. You know what I mean? And it's just the ability of them. I can't talk today. This is crazy. The possibility of them finding out about it because they do have access to medical records for patients and stuff like that. Yeah. So I empathize with that for you and for everyone else who has experienced that in their workplaces. But so we got the diagnosis of Asherman Syndrome at what point during your 5 losses? Was it after all 5 or was it?
Yes,
it was.
With my Dr. Balthazar, she was the one that brought up that possibly could be what it was. And so she sent me to Seattle, Washington, to Pacific Northwest Fertility. And I saw Dr. Julie Lamb. She was amazing. She was very straightforward with me, and we came up with a plan right away about, I was at the time 33, 34 almost. And so it was like, we need to get to work now because time's ticking kind of. And so at that point, it was September of 2014. I coordinated my own IVF. I don't even know how I did this, talking about it, from my remote Eskimo village to Anchorage. I'd see a doctor in Anchorage. And then I'd go to Seattle and see the specialist and then back. And then I'd have to bring my husband. And then, so it was crazy. Luckily, I had friends in Seattle, my dear friends from pharmacy school, and they took great care of me and they would shuttle me, back and forth to my appointments. And, I basically took a 2-week vacation making eggs with them, it was very nice. Yeah. And actually, after my first transfer, we came out of the room and my best friend Annie and her husband Ray were there. And they surprised us. And it was just like we were doing it together. It was so nice. And we all went down, downtown Seattle, you can find anything. So we went and found like gelato or something afterwards to celebrate. So
that must have been really validating to see your friend there the same time as you, and then going through the same thing as you. I would have probably broken out into ugly cry at that point. But so you've had the losses, and you were just speaking about your first IVF attempt, right? When your friend was there too, right? And so at this point, because you were with a therapist, how had the losses affected who you were as a woman and as a human at this point? What kind of mind state do you remember being in at this point?
It was hard. Like talking about it, I'm getting a little choked up because it was the lowest of the low. I mean, it was winter in Alaska, which is cold and dark.
Right.
I mean, it was like -50 sometimes where I was at.
Wow.
And isolated. I didn't have my family, my friends, my people. I had my husband, which I was so thankful for. But I think your marriage, and maybe you can help explain this too, suffers. It's hard because you're going through it and they're going through it, but you don't sometimes know how to communicate that. And so for me, I was the lowest of the low. I think I lost a part of myself. I suffered a lot. And I think that's why I talk a lot about on Instagram. I didn't have Instagram at the time. Instagram was new. They didn't really have these platforms or these groups, or I didn't know about them.
They weren't very prevalent then. And because we're talking about what, the year 2015, 16-ish?
Like 13, 14.
13, 14. Yeah. See, Instagram was new. You could be Instagram famous like way easier back then than you could now, especially in terms of like building a community. A community wasn't even important back then. It was just, we were just sharing our selfies and selfieing it up,
pictures.
And puppy pictures. Like it was so simple. It was a much simpler platform back then and easier to navigate than it is now. And so you spoke of that part of your life in that moment and in that time as being one of the darkest parts of your life. And while you were speaking, I'm thinking, wow, you feel isolated because of your losses and your infertility, and then getting the diagnosis of the Asherman Syndrome after having a procedure done that was supposed to help you, right?
Yeah.
And then you living in a place that's already isolated. So, wow.
Yes, ma'am. Yeah.
That's a lot.
There was no roads to my village. You couldn't drive. You could only fly to Anchorage. 3 flights a day. That was it.
Wow.
Yeah.
Wow.
It's like a third world country there. It was hard.
That's what I've heard, yeah.
I remember just looking out the window to the tundra. It's a beautiful, beautiful thing, the tundra. And I just remember like there was one little tree I would always like look at, and I would just think like, I would like talk to myself. I was going crazy, I think, but I would say, it's going to be okay. You're going to have a baby one day. And I came home that December. So we made the first round of embryos in September, and we ended up with 2 genetically, well, at that time we didn't know, but they were genetically okay embryos only. That's it. And I went in December to Seattle to try to do a transfer, and they said, no, your lining doesn't look good. And so I came home, and I told my husband, I flew home from Seattle, and I said, I don't want a Christmas tree. It was my birthday. I don't want anything. I just want to come home, regroup, go to work, kind of, wallow in my own self-pity. And he picked me up from the airport, and we went around the corner to our house, and there was our Christmas tree all lit up in the window. And that just was like really sweet of him. Yeah. I'm a good husband. Yeah. Really good husband.
Yeah, he sounds like he's
not
amazing.
Perfect, but
we none of us are. We can all we can hope is that there'll be what I like to call the ride or die, the old 90s saying back in the day, ride or die. That's what we're all looking for in companionship at the end of the day. Somebody's going to be there when the going gets tough, and this is the better and the worst part. When you're going through fertility struggles and these types of sicknesses and disorders and conditions and things. So, wow. Were you still going to therapy? Had you stopped?
No, I was still going then. And I think what kept me going was every week my therapist would say that we're just gathering tools for your toolkit. Because I would come in saying, I'm fine. I probably don't need to be here. But, because in my mind, I was like, what's the word? I wasn't accepting that I had a problem, I think.
I get that.
But others around me could see it. Yeah. And I lost friends because I wasn't there.
Yeah, I did too, girl. So I get it. I think a lot of us end up unfortunately going through that. Maybe not everyone. And then I know for myself personally, I wasn't open about my diagnosis. And so they're just thinking that I'm just not showing up. You know what I mean?
Yeah.
And I didn't have many to begin with. So by the time I had my son, it was like I was just starting to rebuild and just starting to open up about the diagnosis. Like literally that summer that I got pregnant, I started telling people, and they was like, why didn't you tell us this 5 or 6 years ago? But it is what it is. And that's why we're here. so that you guys
Yeah.
don't make the same mistakes, you know?
Exactly. And I share often. My partner is very private, my husband, so we didn't share.
Yeah, yeah, mine is too.
So it was
I
a
understand.
titular situation that, yeah, we were very quiet. So so then December was canceled, then January was about to be canceled too. And I remember, I mean, we prayed. My mom had everyone at her little church praying. We were all praying. And they even had me sign a consent to do the whole test to see about the scarring in my uterus. And I was like, well, this is it. We're done. And then I went on a Saturday and saw a different doctor because, on weekends you may not see your normal doctor.
Yeah.
And she's the sweetest. She's like kind of like the mom of the clinic. She founded it. She's an older lady.
Okay.
And Dr. Marshall's her name. And she was like, I think it looks good. And I was like, wait, are you sure? Like, I didn't trust her. And I was like, wait, are you sure? Because we only
Said
have
it
two.
a little bit too fast for me, okay?
Yeah.
Yes.
And she said, let me tell you, if you were my daughter, I would tell you it's okay. We should do this. And that made me feel so good.
Oh, that's wonderful.
So we finally transferred my first embryo then. And then I had McKinley in October.
Oh.
And she's now 6 and she's tall as can be. And
Oh, she looks taller in some of the stories and things you've shared. Yeah.
Yeah.
And what's her birthday? October?
She's October 7th.
My birthday's October 8th.
Is it?
Yes, it is.
Oh.
Libras.
Yes. And we named her McKinley after the mountain.
Oh, that's
in,
beautiful.
Alaska. Yeah, they ended up changing it back to Denali, but that's okay. I'm like, well, it still was McKinley for a while.
I've always wanted to visit Alaska. I watch so many movies and documentaries about Anchorage and stuff. A lot of history, a lot of rich history there. It seems like a beautiful place. So after you had, where you got your BFP, and was that after, you said in our discussion, it was after 2 rounds of IVF, right?
Right. So so we made the first set and then we made some more and we ended up with the 2 embryos and then that was all we had. I mean, as it shrinks down.
Yeah.
And we ended up choosing to do the genetic testing because for us, we didn't want to go through any more losses.
Yeah. Well, that makes sense too, because BGS testing is done when you have recurrent losses, a lot like that. Yeah. So how was it being a pharmacologist, going to work every day, and at this point of moving into IVF? And I remember here it says that you had some cancellations, which we basically were just talking about because of the lining issues and things, right?
I did.
Yeah. So as a professional, that must have been a battle all by itself with having to show up every day. And at this point, were you specializing in the niche that you are in now?
No, okay. I just started sharing my story and like showing, trying to support women with this about a year ago.
Okay.
So no, I didn't even really know anything about this.
Yeah.
This just happened because with COVID, I missed counseling patients. So I work for Indian Health Services. And so I do clinical stuff. Like I do anticoagulation, diabetes management, stuff like that. But then I also just love counseling patients. I love talking to them about their medications, tips and tricks. Like that's my passion. And we are, like I was telling you, not able to see our patients right now. Like they take their medications out and someone takes them to their car. And we are going out more now and talking more face to face than we were. But I missed that. And I had a pharmacy student that was a student in Alaska, and she had reached out and said she was having problems and how did I do it? Because she was living in another, remote village.
Gotcha.
And I said to her, this is how I did it. This is my doctor. I kind of walked, I helped her through it. And now she has a 6-month-old. So about a year ago, I said to my husband, hey, like I helped her. Why can't I help other people? I was missing that passion in my job that I had. So I thought, why can't I put the 2 together?
Yeah.
My passion with fertility stuff and my passion with pharmacy stuff. And so that's kind of what has led me here.
Yeah. And your need to give back, right?
Yeah.
Yeah. I get it. So you have tell us about the first round of IVF that you guys did that was unsuccessful.
So I was lucky and I didn't have any unsuccessful rounds.
Okay.
I'm sorry. We just did 2 to get more eggs.
Got you. Okay. I got you. Just to get okay. Yeah, that makes sense. Yeah. Okay. I misunderstood. Okay.
I'm sorry about that.
No. Cause I just read it wrong in the notes that you sent me. So I read it wrong. Okay. 2 rounds.
Yeah. So
okay.
we got, we didn't get as many as we hoped.
Mm-hmm.
So I think with my age, I had a lower ovarian reserve, but we ended up with the 2. And then I waited a long time before I went for my second embryo transfer, little baby Bristol, because I was scared. I mean, I was very, very scared.
Yeah.
To do it again. It's a lot.
Yeah. And then you had so many losses, and you're trying to find some hope in the midst of still healing from those losses. It does. I don't think like you heal, but it still hurts a lot. It's still there. I think a lot of times when we have so many losses, and then it's just like losing a family member, like you learn to go on, but still that little bit of that sting there a little bit, even in the midst of all of it. So, wow, that's that. And, it never ceases to amaze me how much we actually go through when we sit down and talk about it like this, detail for detail. And, but again, I commend you for seeking help, because a lot of people don't. Yeah. And I'm a huge advocate for that mental health therapy.
The hard part, I think, and for help with our spouses too. Like couples counseling was huge for us. Like, I think, because you can't always talk it out. You don't know what to say or the right way to say it. And
I think we kind of make our husbands or our spouses a little timid anyway, because, just in our daily life where we nag each other, the usual stuff. And I think it makes them feel like they don't know what to say either. We don't know what to say. They don't know what to say. Nobody knows what the F to say. We're just sitting around looking silly, trying to make the best out of it. But that I can imagine that being very, very effective. There was another guest I had about a year ago, and she said the same thing. They were doing couples counseling during the midst of, and it really, really helped. So you guys heard it here first. Dr. Natasha said, go get help. Okay, go get help. And let's get into this IVF round that became your BFP. What were you feeling, and what were you doing the day before your transfer?
You're gonna laugh. I was with my friends in Seattle, and we ended up. They said yes, so let's do the trigger, right?
Yep.
And my husband, I'm trying to even remember. It's been so long ago. He was like on a flight to come be with me because we were all excited.
Right.
And they took me to that wall in Seattle that has all the gum stuck to it.
Yes.
And then we saw the troll under the bridge. And like I said, they were trying to keep me like on a vacation. And it's so funny because my best friend, my one friend, Annie, and her husband that helped me, my other friend, Sharon, and her husband lived there too. And she has this cute little fancy Lexus she bought for herself when she graduated pharmacy school. Yeah. So we were driving down to this fancy Gasworks park, I'll never forget. And it was 3:00. We had to do the trigger shot. And she's a pharmacist too. So she was like, I'll do the shot for you. Well, her husband gets out of the car in this park in Seattle. We're in the back seat, her and I. She's giving me a shot in the behind. And these people are like looking, and her husband's like looking around. And we crawl out of the back seat together. And it just looked not good, but it was funny.
That's funny. That reminds me of you remember the old movies from the late to mid 90s where it was like all those teen movies coming out, like after Clueless, it was like teen movies coming out left and right. And they were always doing something crazy. That's funny. I love you guys were able to do that on that day for something so serious. And it helped you. I'm sure it helped comfort you a lot too, as well.
It did. Yeah. Keep my mind busy or, not thinking so much.
So we go in to the doctor's office. Describe for us the moments of did they put you to sleep for your transfer? Some do and some don't.
They didn't. Nope.
Okay.
I was awake, and I remember I had to go potty so bad because full bladder, and so I was like begging to go to the bathroom, and then diazepam, and I'd never taken it before, but I was a little loopy.
Yeah.
So I was talking all kinds of crazy. But I do remember the nurse looking at me specifically, and she said, "Sweetheart, it'll be okay. This is your turn." And so that stuck with me a lot.
This gave me chills. Wow.
Oh, yeah. And then I remember afterwards, they were like, "Well, get up." And I'm like, "No, I can't." And she goes, "It's not going to fall out of you."
That's how it feels, though. It does feel like it's going to you're going to stand up and it's going to fall out just like semen would, during the normal parts of sex and stuff. Oh, that is funny. Oh, yeah. So we get home and we got this long ASS 2-week wait, right? And so did you work while you were waiting just to keep your mind distracted?
I did, yeah. I worked, and luckily my friend, so I was able to do the labs there in the village at the little hospital. And my friend was one of the nurse for the OBGYN, so she could like check the lab. So I'd be texting her like, is it in? Is it in? Is it in? You know, because, oh my gosh, talk about anxiety. You know, it's like, I hate that. They should not do that. They should like let you wait in a room and like, I don't know. There should be instant results.
I know, right? That would be like, that would be so much more easier than having to go through the 2-week wait. And then like some doctors like mine, they make you wait all day before they call you with the results, or the lab was just slow about getting the results to them. I had to wait till like clock out time, and they were like literally closed already. And when they called me, it was like 4:00 in the afternoon. I'll never forget it. So did you know, or did you have any inclinations as to what your results would be on the day that you got your testing? Did you have any kind of like clues or anything?
Not the first one, no. The second one, I did take a pregnancy test, and I know you're not supposed to. I know, but I did, and it did say positive. So I thought I was hopeful, but yeah, with McKinley, I didn't. And then I'm trying to remember. It's been so long. I felt like everything went pretty good. The numbers were good. I didn't have any problems at the beginning. And I remember we went to Anchorage for the first ultrasound, and oh my gosh, I was just sick waiting to go to that ultrasound, just sick. And then I remember we saw like the little, the little yolk sack, and the lady explained to us it's like a backpack, and so we called her backpack for like the whole pregnancy. I don't know
It's
why.
so cute though. Yes, yes.
So, but I mean, we didn't. I remember my husband's mom's birthday is April, like late April, and she called one day and she was like, "Can I please tell your brothers and sisters, like they are begging. They know something's going on," because we had told our parents, but said, please don't say anything. So I think by then I was pretty close or past the 12 weeks, but I think we finally were allowing it. And I had wore, where I worked there at the pharmacy, you didn't really have to dress up. You could wear jeans because I don't know, they let you. And I would wear like a down, it was cold. So I wore a down, like Land's End vest every day, and I covered it up. And then one day I just had a pregnant belly, and it was like summertime, and they were like, what?
Surprise.
Yeah.
Yes.
I think I was just so scared. I was waiting for that shoe to drop, the other shoe to drop, or something bad to happen.
Yeah. I mean, I think that's pretty normal considering how many losses you had. And, and I even hate to say that, because it's almost kind of, it makes me feel like I'm being dismissive, like your losses aren't important too. But I know you probably didn't take it that way, but,
No.
wow. So how did your pregnancy go with her?
It went good.
It did. Good.
I didn't enjoy it because I was so stressed for me. I felt that I was going to tell you the one thing I regret is I never took pictures of myself pregnant, because I don't know why.
Wow.
I think I was so in my head or scared, or I really don't know. And when she came, I remember telling my mom, like, I just want her back in there. I was just getting used to being pregnant. My mom was like, you're crazy.
Yeah.
But yeah, she came a little early because my blood pressure started getting a little high.
Okay.
Nothing crazy like my little Bristol. Bristol came really early and had to be in the NICU for 2 months.
Wow.
So that pregnancy is just not my friend. So we're done, but.
And he's 2, right?
Bristol, she's 2.
Yep, she's 2.
She just turned 2 in September, and she's a little naughty one, I tell you. I think the little ones are naughty.
The youngest are always the wildest. I'm the youngest in my family, so I was always the most vocal. Even though I'm like ambiverted, but with the family, I was always real vocal, telling everybody no. Even to this day, I'm still the most vocal one. My sister tells me. But so with your IVF with Bristol, you guys waited, 3.5, 4 years before going back?
We did, yeah. We decided to move home in 2017 to Idaho, to North Idaho, where my husband's from. I think it was just, there's no childcare where we were at, and she was getting older, and we wanted to get her into, a pretty good like daycare or school. And a job came open at the hospital here, and my husband took it, so we went for it. We had to be separated a little bit of time because I had signed a contract with the state.
Yeah, okay.
For my student loaner payment. Yeah. So to finish that out, he came here and we stayed up there for a little bit. It was only like 3 months, but so when we got here, I just, I enjoyed being a mom. I was able to work part-time, so that was awesome. And we did play dates and park dates, and it was just really fun. And I kind of felt that looming over me, like, okay, we have one more. And it's so silly. Our storage was up. Once you have 5 years, they make you move it to somewhere else. And so that was kind of hanging over our head. You know, I was worried about that. I didn't know what that would do.
Yeah.
So I just said, well, let's do this. And I remember I called my mom. I can't remember if it was the night before I was going, because I had to fly back to Seattle again.
Okay.
And actually my husband couldn't even come this time. My two friends I was telling you about, Annie and Sharon, they were there with me because my husband had just started a different job and he wasn't able to take the time off. So, I flew over. I did all the medications here ahead of time in Idaho, and then I flew over to Seattle, which is like an hour flight. And I showed up, went to the doctor, did the transfer. I think I might have stayed a night and came home. So it's crazy, you know, what they can do these days. But
yeah, for sure. And I think it's amazing that you had your two embryos and both were successful. So congratulations to you guys.
Thank you.
That doesn't happen often.
Lucky.
I feel like that's almost like an anomaly or something in the fertility struggle world, because especially when you have issues with egg quality and things like that, like you had mentioned possibly before, you might have had some of that. So you had these two babies, and you're doing your mom thing, your pharmacology thing, your wife thing, and then COVID hits, and you spoke briefly about it earlier, and I wanted to get more into that, of you going into the niche of fertility struggles. And so do you advocate and advise about medicine? And there was a post I wanted to share too. I might add it to the video, that you said that medication may not always be the answer. That really struck me the other week when you posted that. I had screenshotted it too, so don't forget.
Oh, well, thank you. I hope I didn't offend you or anyone with that.
No,
but yeah, I really feel like I say all the time, like I'm the worst pill pusher in the world, because I just feel like I'm very all about deprescribing. You know, I see so many patients. I wish I could explain.
Share more,
I
right?
remember, I went into a room one time with this sweet old lady, and where I work, if you're a native beneficiary, you don't pay for your medications.
Okay.
And so they're very blessed in that way. But they asked the pharmacist to come in and speak with her about her medications. And so I was organizing them and helping her do a little pill box. And she had like omeprazole to the ceiling. Like every month we were just filling it. And then I'm like, do you even need this? Like, and she's like, no, I told my doctor, but they keep refilling, you know? And so I feel like if we take time to, you know, I know there can only be so much time in a visit, but if we take time to stop and listen to patients and to say, hey, you know, are you using this? Is this helping you? Let's try to, you know, especially for our elders, like I feel like it's confusing. It's hard for us, you know, for me. So I'm very all about deprescribing. And then the fertility world, I've been super interested lately in inositol, and I know they compare it a lot with metformin. It's a supplement.
Okay.
A lot of people use it with PCOS, so I've been researching that a little bit, and they use it together, I guess, with metformin. So I was gonna hopefully be doing a post on that later. But yeah, I just feel like for me, acupuncture was huge with the lining issues that I have.
That makes sense.
It really helped a lot. I did that. I tried to lose, I think before I did my second transfer, I lost about 20 pounds, 25 pounds.
Okay.
For me, I tried the keto diet, and that's not for everyone. It was a little hard.
It's
hard.
very difficult.
Very hard.
Never again for me.
I did Weight Watchers and I did better because, you know, it's more sustainable.
Exactly.
But yeah, so, I mean, I think losing weight helped me. I think the acupuncture helped me. And I actually got back into therapy again, and that helped huge.
Wonderful. Wonderful. And how has helping others in the community and advising and mentoring and coaching, how has that helped change you and help you heal as an individual who's also been through fertility struggles?
It's helped me tremendously. I think I share that often, that I didn't realize doing this would help me heal, but it really has, because I think, I'm not sure the dynamic in it, but sharing your story and then the validation of someone else saying, yes, I went through that too. Or like you saying your spouse or partner's private also, like that just makes me feel, you know, it makes me feel a little better, because it's like, is this normal? Is this how, you know, because in the middle of those struggles, you're so frustrated. And at that time, if I would have known you, I would have been like, Monique, hey, like my husband, he won't talk about this either. What do you do? Like our friends are thinking we're rude. We don't do anything. We're just heads down, you know, quiet. Something's wrong. They all know, but we're not saying, like, how do you deal with that? So I just I really appreciate the community and everyone embracing me. And yeah, and I get a lot of questions about medication side
I can
effects. So
imagine. Yeah.
that's my goal, to kind of,
Just
lean
continue
on
to
more.
educate. Yeah. I think the
Yeah.
education part is so important too, especially in the fertility world, because like, first of all, a lot of us have conditions that we're taking medication before we even start fertility treatments. And like one young lady, for instance, her name is Ashley, and she's public about her fertility struggles, and she has like lupus, and she has PCOS. And I think that what you're doing is a game changer, because people can come directly to the source when they want more information about their medications, and then taking the knowledge they've gained from you and going to their specialist, and just kind of trying to work through the plan and the protocols a little bit better with a better understanding too. So I think it's going to be really important going forward, even more what you're doing for the
Well, thank
community.
you.
Yeah, I
And even
admire it.
something,
Yeah, for sure.
well, thank you. Even something as simple as, I think my first post was how to draw progesterone. That was like one of my favorite posts, because it's intimidating.
Yeah.
If you're not used to giving an injection to yourself every day, it's very scary,
Yeah.
let alone with all the other things that we're dealing with too.
Yeah, especially the long needles to go with it. Yeah, you to be what with this? Come on, what? Oh, yeah, for sure. And I also wanted to ask, what would you want others to know in the community?
I guess just try not, I always say don't give up. And I know people don't like that. It sounds like shallow, and I don't mean it that way at all. But I think that was just my mantra over and over. Like, I cannot allow myself to stop. Like, get to work, keep going. There's a way for me to be a mom. If it means adoption, if it means, and I think that's just what I told myself the whole time, was that some way, somehow, I always say I wish I could give everyone a crystal ball. Like, here's your crystal ball. This is what's going to happen for you.
Yeah.
Because we all want to know that, right?
Yeah, we do. We do. We do all want to know it. And it's it's a lot. And the only thing, like you were saying about the don't give up quote or affirmation, however people like to use it, is that we have to be really careful with that, like you were just saying. And I stand behind that 100%. If that's not how you feel, then don't say it. And if that's how you feel, then go with that too. And just being mindful about where we are emotionally and what we can handle, and what we need. Being honest about what we need too, right?
Right.
And communicating that.
How do you recommend a person when, because I think about that often, like what would have been my stopping point? I'm not sure. I don't know. I don't know if I would let my mind go there.
I always knew I didn't want to do more than 5 cycles in 1 year. So if it took me, a whole year to get through 5 cycles, that was okay with me. And at one point it was 3. And when I got the transfer that I did for my son, at that point I was like, maybe I won't do anything after this. I was just really taking it step by step, really. So the first unsuccessful embryo development was unsuccessful, and then we never got to the point of transferring. So I was like, okay, I'm gonna do it one more time, and I don't know what I'm gonna do after that. But I did kind of have like an idea of what I would allow myself to go through at one time before taking a break, or just stopping completely and just say maybe this isn't in the cards for us, And I think that's important too for everybody to know before we transition out of today's conversation. Is really just being mindful of that, and not just for yourself, but for your partner too, because you might be willing to go forward, but maybe they aren't.
Yeah, no, I totally agree. I like that. I think thinking back on it, maybe that's how I coped with it too, was like a step by step. I have to be in control of everything. It's my downfall, and I have to plan. I'm like type A to the last little minute, and so once I had a plan, I was fine, but otherwise I was like out of control. So.
Yeah, it does
in my
feel
mind,
like that. Yeah, I resonate with that. If there's anything else you'd like to say to everyone, you could do it at this time, Dr. Natasha, before we close out for the day.
Yeah, just that I made a free guide if anyone's trying to conceive. It's www.fertilitypharmacist.com/freebie. So it's kind of cool. I put a whole supplement thing in there, and then there's a fun quiz at the end. So yeah, I just really enjoyed making it, and I like to talk about supplements and medications, especially for us and for our partners. I'm always trying to be inclusive with the partner situation, because I think for me and my partner, that was lacking.
Yeah, yeah. Whew, if we could go back in time just to fix a couple of things, just a couple, not too much, not too much. So I'm going to have all of Dr. Natasha's information in the show notes or show details, whatever platform you're listening and or watching from. So you can connect with her on Instagram, as well as get your freebie and information about medications and supplements, and reach out to her by email or Instagram DMs. You can slide in her DMs. And so Dr. Natasha, I appreciate you, girl, for coming on the show.
Thank you so much.
I appreciate you so much.
I've been admiring you for like a year. I love your reels. Like, you always cheer me up when I'm down. So thank you for everything.
Well, that makes my heart all warm and fuzzy today. So thank you, friends, for tuning in to Infertility and Me podcast. Peace and blessings.